Excellent. Thank you. Welcome. Great to have you join us today for Results Canada webinar series. We're very excited today to discuss and celebrate with all of you how far we have come on women and children's health. So just before we begin, and I pass it over to our guest speaker, just a few housekeeping. So throughout the presentation, we kindly ask you to make sure that you are muted to make sure that everyone can hear clearly. We will have an opportunity to have a discussion. So by then, I'll make sure that everyone is able to speak. We also have a chat box. So if at any time you are running into any issues, you cannot hear us, or you have a question or something to raise, please use this chat box. I think that covers our housekeeping. And in case you are new to Results, I'm very quickly happy to explain to you a little bit who Results Canada is. So we are a national grassroots advocacy organization that has been around for more than 30 years, and we believe in empowering citizens to use their voices to influence the political will to end poverty. So we're a passionate group of volunteers and staff working together as advocates, and we aim at having an impact on the world. Yes. Hi, Chris.
Uh-oh.
Did we just lose our guest speaker? Chris,
I'm here now, yes.
Okay, great. So as I was saying, we are a passionate group of volunteers and staff working together as advocates, and we aim at having an impact on the world through different advocacy actions, such as writing media pieces and meeting with federal members of parliament. So what we do really is we combine the voices of our grassroots advocates with strategic advocacy efforts to leverage millions of dollars for programs and improve policies that give people of the global south living in poverty an access to health, education, and an opportunity they need to thrive. And hopefully, Chris, you're on the line.
I am.
So great. So I'm happy to pass it over to Chris Dendys, who will be leading our discussion today.
Thank you, Melissa, and welcome everybody to this webinar. I should start by sharing the impetus, which, you know, for me was a feeling that there's, you know, a lot of heavy headlines out there, a lot of gloom and doom, and it's really easy to get bogged down by all of that negativity. And anger and frustration over inequity and injustice, it does fuel our passion, but it doesn't really fill the tank. It doesn't kind of keep us going, I don't think. So the truth is, and the point of this webinar is that we're making progress, that change is possible. And so this webinar focusing on how far we've come is meant to be a bit of a reminder of that. Slide. So that desire to fuel the tank is the real impetus for this call, and for what I hope will be more discussion than lecture. I'll be doing a bit of the talking for the first part. So we're going to try to use this hour efficiently, bridging from some discussion of some of the touch points for progress, is what I'm calling them, touch points for progress achieved, and then bridging to some considerations of what should and could inform our path forward. There'll be some time for discussion, and then, because we're Results, a way to get engaged and to become part of the change that we want to see in the world. Slide. But before we dig in, I did want to flag a few sources, and this is recorded so you can come back and look at this at any point, but that really demand some acknowledgement. There are many out there, but I specifically wanted to point to these three. The first is gapminder.org. This is, for those of you who are aware of Hans Rosling, who passed away last year, actually, this is his site with his partners Anna and Ola. ourworldindata.org. I'll be quoting somebody named Max Poser later, and this is that site. And also the Gates Foundation, which, you know, specifically related to their Goalkeepers Initiative, has a lot of terrific analysis, statistics, positive news, also some of the challenges, but is really worth looking at. So, slide. So just to begin, why hope matters. So beyond just the impetus to fuel our tank, you know, I wanted to start by saying when I joined Results, which was over 10 years ago now, first as a staffer, then later as a volunteer, and now back as a staff member, the thing that changed me for then and forever was that I became really lit up by the mission to end extreme poverty, which in turn then demanded that I bought into the fact that a world free of extreme poverty was possible, that it might take a while to get there, But even though the journey is long, that if we advocated around the steps, we would reach the destination. And along the way, you know, I think it's fair to say that at times I've been accused of using the term hope and solutions a bit too much. In fact, my staff, who I actually love, some of whom might be on this call, I have to think a bit facetiously even named our 2 office meeting rooms. One is called Hope and one is called Solutions. But I wanted to say that I'm not a Pollyanna. Later we're going to talk about how much more needs to be done, and there's a lot that needs to be done. But when people wrongly believe that things are hopeless and that nothing is improving, they might conclude that investments are wasted and that our work is pointless. They might want to veer to the radical, you know, like put everything in the hands of the private sector or cut aids, etc. And, you know, from my perspective, being hopeless or cynical can be a road to inaction. So realism, yes, but cynicism, no. So this webinar is meant to remind us that progress is possible, and although there's a lot left to do, in fact, we're on the right course. Slide. Rosling and all assign a number of different reasons for the disconnect between the reality of global trends and people's perception. And I just wanted to start with that because in his book, Factfulness, which is up on the screen, he outlines 10 perceptions and tendencies or barriers that contribute to this tendency of ours to not believe that we've achieved as much progress as we have, which we're going to get into in a minute. And I'm not going to go into all of his rationale here. Consider this a plug to buy the book, which was transformative when I read it. But suffice to say, the reasons we lean towards the negative are varied. And these instincts are so predominant that as Rosling traveled the world, he argued that when asked simple questions about global trends, we systematically get the answers wrong. Our instinct, whether teachers or bankers or Nobel laureates, was to always lean towards the negative. So if presented with the question, is the world getting better, the majority thought it was not. Slide. So ultimately, the point is, too often bad news wins. The truth is the world is actually getting so much better by almost any measure. Bad things are decreasing, from slavery to deaths from natural causes to child labor, and good things are increasing, from literacy to internet access to electricity coverage. Slide. And when it comes to extreme poverty and both the causes and consequences, which is where we put so much of our attention as advocates, the world is far better than it used to be. The economist Max Roser, the brain behind Our World in Data, as I pointed out earlier, has said that on every day in the last 25 years, there could have been a newspaper headline reading, the number of people living in extreme poverty fell by 137,000 since yesterday. That's what we're going to spend a little bit of time unpacking now. But I just wanted to start with that because I think it's incredibly powerful and not something that gets amplified enough. Slide. Because progress is possible, and we'll never get where we're going without acknowledging where we've been. So to unpack this progress, and slide. So to unpack this progress and before we get into what I call the proof points of progress, as I noted, I needed to share one important fact, and this is coming from Rosling's work. It's possibly, in his view, the most important fact, and it relates to a deeper understanding of how the world population is divided up by income now and how it has been in the past. So there are 7 billion people on the planet, and each of those billions is represented by these little human tokens on this slide. And again, this is thanks to Gapminder, which provides all of this for free. Slide. And despite the fact that we have a tendency to see the world as 2 distinct camps, developed and developing, it's simply not that way anymore. And on this slide, Rosling divides the world into 4 income levels. Level 1 is the 1 billion who live in extreme poverty. That's less than the equivalent of $1.90 per day. Level 4 is the 1 billion that end up on the other spectrum, the wealthy. That's basically us. Officially, that's more than $32 a day, but it can be much more, as we know. But now more than ever, the vast majority live in the middle, level 2 and 3, and that's a signal of progress. Slide. Because it means that people are on the move. In this pictograph, Rosling describes the real world difference between the categories. So level 1 is not an easy place to be. Your children may spend hours walking back and forth barefoot to fetch water from a dirty mud hole. Your diet might be a bowl of the same gray gruel that you've been eating every day, he says. Your children are often malnourished. If you get sick from TB, tuberculosis, which is an issue and a disease of poverty that Results does a lot of work on, or something else, the consequences are cataclysmic. But since 2000, more than 1 billion people have lifted themselves out of extreme poverty. And that number is so huge that it's almost impossible to appreciate the scale of the achievement. Above the $1.90 a day threshold, people might still be poor, but they're thinking beyond mere survival and they're looking towards the future. Next slide, please. So this chart is the quickest way to show that the main source of all of this human suffering has almost, it hasn't disappeared, but it's almost disappeared. And only the last 10% are still dreaming of escaping what many of us would presume is kind of a hellish existence. In 1990, every third person in the world was living in extreme poverty. 25 years later, the number of people living in extreme poverty has more than halved to 706 million. So every 10th person, not every third. That's progress. Slide. Sorry, I'm just making sure we're... So bringing us to the impact on women and children's health and progress. This has been monumental. So in the past 25 years, for many who have been around for a while working as advocates, childhood deaths have dropped from over 12 million a year to about 5 million a year. And the goal now is to cut that number in half again by 2030 to 2.5 million. This is like nothing short than what many have called a revolution in child survival. And it's for all sorts of reasons that we can unpack and we can discuss. But suffice to say, things are getting better. Fewer and fewer children are dying. It's harder to reach the ones potentially who are, and we'll talk about that later. But really, this is nothing short of a revolution. And here are some of the proof points of that reality. Slide. So children are being immunized. Almost 9 out of every 10 children in the world are immunized, receiving at least one vaccination before the age of 1. And vaccines are really one of the most successful and cost-effective health investments in history. You're going to see that theme over and over again. Proven, cost-effective, tangible solutions. And thanks to global instruments like Gavi, it's estimated that vaccinations currently save between 2 and 3 million lives every single year. It's a big area of focus for results. It has been for a very long time. And it's a big reason why those child survival rates are getting better. Slide. Polio. Polio could be the second infectious disease after smallpox that is literally wiped off the planet. Again, an area that Results volunteers have done a lot of work on, and many advocates around the world. The real heroes being frontline health workers, and the real heroes being moms who bring their kids to get polio vaccinations in places throughout the world. But the fact that 80% of the world's population live in regions certified as polio-free is a monumental human achievement. Slide. Malaria is on the decline. So malaria is one of the 3 leading killers traditionally of children under 5, along with diarrhea and pneumonia. It's been cut by more than half. It's the poster child of a simple recipe being deployed that can have profound impact. Bed nets, rapid diagnostic kits so that kids with fever are treated quickly with the right drugs, the right diagnosis. ACTs, which is an effective drug, artemisinin-based combination therapy, which replaced the old chloroquine, which was, people were becoming drug resistant. Indoor spraying to fight mosquitoes. All of those things, those elements, those really simple elements come together to make up the recipe. And along with really powerful instruments like the Global Fund to Fight AIDS, TB, and Malaria, which has had massive impact in terms of those 3 infectious killers. But malaria specifically has had massive impact in that space. And political will. All of these things, the recipe, the instruments, the political will, they've merged to see rapid progress in literally cutting malaria deaths by more than half. Slide. And fewer children are malnourished. I mean, the numbers are still terrible that a quarter of children in 2016 were stunted, but fewer children are malnourished. The progress trends are on the right path, with stunting falling from 36% to 26% of children in just 15 years. Like, think about it. That's the age of my youngest son. Like, that's in his lifetime. That's the difference that has been made in children's lives around the world. And just to make it clear, stunting occurs when children don't get the nourishment they need in the first 1,000 days of life, from conception to their 2nd birthday. So the outward sign is a child is short for their age, but the truth is stunting is a sign of cognitive and physical deficiencies that, set them up for a lifetime of lost potential. Slide. And in terms of clean water, more people have clean drinking water than really did just even a few short years ago. The challenges continue to be immense, but statistics demonstrate that, again, the trends are on the right path and progress is possible. And that's, again, the overriding theme of this presentation. Slide. Another sign of progress is in declining fertility rates. Since 1960, the fertility rate has fallen by half. And until the late 60s, each woman had on average more than 5 children. And that's because the availability of contraceptives really allowed parents to have only as many children as they wanted, but also that sort of shift to the middle, that socioeconomic changes that move people out of extreme poverty also had a huge role to play. Rosa has pointed out that from decades of demographic research, we know that women decide to have fewer children as they get access to better education, better opportunities in the job market. And we also know that when child mortality falls, so that families don't need to fear that their children will die, they consequently decide to have fewer children in the first place. Improvements in conditions for women and the health of children have driven a rapid reduction in fertility rates across the world. And that rate has halved in the last 50 years, from more than 5 children to fewer than 2.5 children. In addition, the world's population growth rate has also halved in the last 50 years and is just about 1%. So the trend is that as women's fertility goes up, global population does not increase, it goes down. But also as children survive, that's also the case. Slide. And just to talk about maternal mortality as well, since we're talking about women's health and children's health in this presentation, when women did have children or do have children, their chances of surviving pregnancy and birth have dramatically improved. So between 1990 and 2015, the era of the MDGs, maternal mortality worldwide dropped by about 44%. It's due to a whole sorts of reasons, and it's not good enough, but it's still, again, a step in the right direction. Finally, the last proof point I'll allude to, and this is slide, we're on the education slide now on the list. Finally, as the last of my progress proof points, and again, I could have picked many, and a lot of these are just really subjective, pulled from where I kind of felt compelled to kind of bring the conversation. But today, 9 out of 10 children in the world attend primary school. In all low-income countries across the world, 60% of girls finish primary school. They finish primary school. And this is radical benefits, particularly girls' education. And for those of us who worked on the G7 education initiative to educate girls in emergencies, we know this all too well, right? When women are educated, all kinds of progress is achieved. The workforce becomes diversified and stronger. Educated mothers decide to have fewer children. More children survive. More energy is invested in each child. It is just a virtuous cycle that is tied to health, that is tied to economic capacity, opportunity, and really globally transformative trends that make a huge difference. Next slide. So just for the next few slides, and perhaps as fuel for our discussion, I'm going to turn down the volume on the progress proof points and share some thoughts on why the fight is, as we all know, is really not over. Slide. So here's a list of some things to think about, and I don't have definitive things to say on each of these topics. Again, they were just things that really prodded my mind to kind of pathways for thinking and thinking about what's next and what all of this progress means. As I said, there's a lot to be proud of. There's still a lot left to do, but progress doesn't mean that the job is done. I think it's obvious, but it's worth restating. 1 billion people still live below $1.90 a day, and by any absolute measure or any relative measure, that's just, it's not acceptable. It's not acceptable in terms of their aspirations and what they want to achieve, but it's not acceptable to the world, which is, shrinking all of the time. And so progress does not mean the job is done. Rosling equates it to thinking about the fact that while we can celebrate success, if you think about a child that's in an incubator, we can ensure that that child is doing better, that he's on the road to recovery, or she is, that things are looking good, but they're still in the incubator. There's still work to be done. They're not, we haven't finished yet. They're not well, and they're not vibrant, and they're not dynamic at this point. So that progress does not mean the job is done. I think that's obvious. Slide. And really, even as we talk about global trends, it's extremely clear that advances are uneven. So uneven progress to a large degree. The progress that we've achieved, really the massive progress globally, has come in waves. It's in a large part due to progress, as I understand it, in 2 big countries, China and India. And many feel that a third wave of progress in Africa is really necessary, but completely possible. Even the global child mortality curve that I was just speaking so passionately about doesn't tell the whole story. It hides an important insight about what it will take to save the next 5 million lives, the kids that are still dying below their 5th birthday. In an opinion piece, Melinda Gates makes the point that if we were to break this single global line into separate lines for each country, we'd see that there's massive differences among them. So children are 75 more times more likely to die if they happen to be born in Angola instead of Finland. I mean, there's still wild discrepancies within the world, even though the gap is a misnomer, that there's lots of people in the middle. There's still, a lottery to be won, unfortunately, in terms of where one lives, based on what your opportunities are, what your chances of survival are, even as a small child. And slide. And I think, again, sorry, poverty is sexist. We've heard this term bandied about massively, but this is a presentation on women and children's health and women's health. But the truth is, there's still tremendous inequities related to sex and gender when it comes to poverty. One thing that's always stood out for me, for example, and it's just, again, a little bit of a proof point of that inequity, is having worked for a while focusing on malnutrition. There are global goals related to addressing malnutrition in the world. And one of the leading indicators of malnutrition is anemia, severe anemia. There's about 6 different objectives or goals globally to address malnutrition, everything from stunting to low birth weight to other things. But anemia is by far the most off track of the global nutrition targets. And it just happens to also be the indicator that is most prevalent among women for biology and for all sorts of reasons. 1 billion women, or half a billion women are anemic, and it just, puts the brakes on development in terms of their energy, their capacity to lead, their capacity to have safe birthing and everything else. So poverty continues to be sexist. Girls are still 2.5 times less likely to attend school, even though the global numbers are on the incline. And we always need to be thinking about sort of gender and taking that into account when we talk about sort of the now what and where progress is feasible and possible. Next slide. In terms of the now what and seizing an opportunity, I think the other thing that I wanted to share that I find particularly compelling, and has been something that has been particularly compelling as I have thought about the work and have thought about the things that I feel passionate about right now in terms of really monopolizing on, is that the world is really young, that there's a tremendous opportunity to be seized here. Today's generation of young people is the largest in history. Half of the world's population is under 25. 9 out of 10 to 24-year-olds live in low-income countries. 9 out of 10 to 24-year-olds live in low-income countries. And the youth population is booming in some very volatile regions of the world. The median age of people in Africa, of the demographic in Africa, is 18. I mean, that's astounding. This massive wave of youth, though it needs to be said, it could be seen as a threat, or it could be viewed as an opportunity to support a generation of young people who are equipped to transform the world. Because so many people are young right now, this is the opportunity to really dig into the interventions, the approaches that have worked, particularly when it comes to youth, it comes to health, and make a difference so that this generation is equipped, healthy, and educated, not only to save their lives and their families' lives and their communities' lives and play a role in developing their country, but really helping to sort of address some of the bigger other global sort of challenges that we face collectively, whether it's global warming or it's other things that we need to address. But I think it's an exciting and interesting thing in terms of the thinking about the now what. Slide. Also, now what, in terms of considering where to go or what to be considering as we kind of move forward, is I just wanted to unpack a little bit the global burden of disease, and that sort of sense that we can prioritize, because we know where we've been, the actions and what actions we need to take to get the job done. And just to begin, just next slide, Melissa. This slide kind of divides the world up by the global burden of disease. So specifically between non-communicable diseases and communicable diseases. And the slide that I think Melissa is showing right now has a whole bunch of, the different sort of elements of those. Non-communicable disease is a medical condition or disease that is not caused by infectious agents. That's That's represented by the light blue sort of categories, things like heart disease or other chronic illnesses. And a communicable disease is represented by the red as an infectious disease that's transmissible, it's something you can catch. So Melissa, just moving to the next slide. Hello? Just moving to the next slide. This is just another way of imaging it. This slide divides the world up by the, it's 61% of the global disease burden are defined as non-communicable, 28% are communicable. So why does that matter to the conversation that we're having today? Next slide, please. It matters because the breakdown by income level, again, thanks to Rosling, is really interesting because the implications also have impact. So as people get richer, they suffer less from communicable diseases. It's the overly simplistic reason, but still valid reason, is that they can afford cheap preventions and treatments and they live longer, and instead they suffer later in life from not, and can afford the more expensive preventions and treatments of non-communicable diseases. So you can see that breakdown. Still a lot in the middle, but when you look at the difference between, next slide, Melissa, when you look at the difference between level 1, where the poorest billion are, and level 4, you can see that this does have an impact. So that means for the bottom billion, progress is still necessary when it comes to addressing communicable diseases. And that's where the largest percentage of suffering is, and it's clearly something that traps people in poverty. And you know, I've highlighted the fact that these are areas where we have solutions. The progress that we talked about earlier in terms of immunizations, in terms of treatments, in terms of protocols, and the things that are working that we aren't doing enough of in terms of healthcare close to home, community health workers, bringing those sort of the cost-effective tangible solutions to address those kind of communicable diseases, which can have profound multiplier impact for the poorest billion. That's within our grasp because we've done it before. We've seen achievements in that space. So that's why I wanted to share, you know, that kind of disaggregation about where global disease burden is when it comes to the richest, the poorest, and the middle. Next slide. I wanted to bring it to this too. It kind of speaks to the inequity and unevenness, but that broader notion that, you know, the poor is not one amorphous big bulge of people, that there are categorizations. We've talked about the income levels in terms of the globe writ large, but even amongst those living in the bottom billion, where we want to put our impact and our emphasis and scale up the things that work. We also know that about 400 million people are classified as ultra poor. That is, they're in the lowest rungs of the ladder, that for them, escape even out of extreme poverty is massively challenging. But through some really amazing research and some analysis and some work that's being undertaken right now and some work that Results actually wants to get into, we know that a lot of those ultra poor, people living in ultra poverty, are concentrated in 14 countries primarily. And that we have scalable solutions. There are programs called graduation programs that have been pioneered by BRAC. There are microcredit programs that bridge global health, but primarily these graduation programs that are integrated models to really address the needs of the ultra poor that have been already pioneered and are ready to not replicate, but adapt, because you can't replicate, you have to always adapt programs so that they have impact, but to bring to scale, but this is within our grasp. So this is an area of work that has tremendous possibility, even when we look at the bottom rungs of the ladder. There's lots of hope, even in those bottom 400 million. Next slide, please. So, you know, ultimately, you know, that's sort of the end of the formal part of this presentation. I guess I just want to say, you know, to me, the question is not to feel discouraged, it's to feel empowered by where we've been, what we've achieved globally, what we continue to achieve, that the numbers continue to go back down, that tomorrow's headline could be another 138 million people have been lifted out of extreme poverty, that we need to sort of shout that from the towers and the rafters, and we need to bet on success. I mean, why not bet on success? Why not do the things that we've been doing, but continue to do them well, to adapt them to make sure that they're effective for those that we really need to reach, the ones that are left behind, to ensure that no one's left behind. So the point, I think, of this presentation has been progress is possible. Let's continue on this path. let's be proud of this and let's use that as a guide to what we want to do into the future. And ultimately, let's bet on success. So that is the end of the formal presentation, Melissa. And now, maybe slide, we can dig into the discussion for anybody that wants to participate that way.
Excellent. Thank you so much, Chris. That was great. Very informative. So now I would like to open the floor or the mic or the chat box to anyone who would like to ask a question, comment, react to anything, or who would like to add their own perspective as well. So I'm going to go through and make sure that I unmute you all. And if you do not want to be unmuted, you can simply mute yourself again. While you're thinking of your question or your comment, I'll just read a comment from Sherry, Chris. So her mic is not working, but she says, wonderful presentation. Thank you, Chris. And she will share the recording on social media and also at her next Ladies Issues lunch, as their topic is good news.
Are you guys getting echoes? I think it's Chris. I think she's muted.
I don't know if someone was trying to say something. Right, let me just see if someone has their hand up as well. Any other questions, or rather any other comments or questions? Chris, you were that good.
Hello.
Hi.
Hey, it's Neha. How are you guys?
Hi, Neha. Go ahead.
Hey, I had a quick question. And again, always rightfully talking about politicians as usual. I think this information is really interesting, especially considering I'm not really from the sector completely, but I think this is really great information because a lot of MPs that I speak with, I think this would kind of be something that I think would give them that hope. So I really appreciate the time and energy, and I've learned a lot, especially on this topic. So Chris, I was wondering if you could give some thoughts or ideas, and I know you also appreciate a lot of advocacy work. So how we can kind of make this presentation digestible to MPs, or what your thoughts are around that, or anyone really on the call, and always open to hearing suggestions and how we can kind of use this great news and also propel for better news in terms of MP engagement.
As always, an excellent question, Neha. I don't know if there's anybody on the phone that on the line. Again, I don't want this to be it's not necessarily a Q&A, it's more of a discussion. If there's others that have thoughts. I mean, I'll start by saying, boy, we just don't lead with the positive, even in the way that we message things to parliamentarians. We often sort of frame it in the what's left to be done. And I think that's kind of human instinct. It's this thought that that by painting it in the bleakest terms, that will somehow make the case for more investment. And I don't know that that's working. It doesn't feel like it is. Our aid budget is dwindling. It's the lowest it's been in a generation. I mean, is that because the work is over? No, we know that it's not. So I do feel like maybe we've got to think of tactics and tools to kind of get some of the good news out while not being too Pollyanna, because there's so much more to do. But I do think it refines in it, knowing the facts and the way that they present it, or have tried to present them, or decipher some of the other smart thinking in the world to kind of, repeat it only. Is that this idea of betting on a winner makes sense to me. Nobody, including politicians, wants to throw good money after bad. They want to throw money on places where it can have the most impact. We know that from those issues that we've been successful on in terms of results advocacy over the years. And so I guess we just have to, lead from the winning sort of proposition and the stance. Maybe it makes this understanding also, though, makes our asks a little bit more refined, because the specificity of inequity, the specificity of the things still left to be done, the fact that the kids that are dying are really most of them are in the first month, if not in the first 48 hours. That necessitates different kinds of solutions than some of the simpler solutions that we've already kind of invoked and that we've seen progress in. So maybe it refines our asks, it refines areas of policy discussion. So there's just, a lot there, but in terms of broad scale communications and lighting them up to the fact that that there's possibility for progress, I guess we're going to have to incorporate it, or we should, from my gut feeling, incorporate it into more of what we do, more of what we say, kind of lead with that as opposed to bury it. I mean, that's my gut, but I don't know. There may be a reason why bad news sometimes sells. We'll have to kind of think it through. I don't know if others have thoughts on that.
Melissa, can you hear me?
Yes.
Oh, good. So, Chris, yeah, great presentation as well. And your point about anyway, I think that we have to have, and maybe one of Results' strengths is that we do have the ability to have a more nuanced discussion about some of the issues, because we don't, necessarily rely just on a 40-character tweet, that we are able to, and your facts support that, or your presentation here supports that, and the Gapminder book by Hans supports that as well. That we have to have when we make our asks, we need to be looking at breaking it down, not having it's the us versus them or the developing versus developed world. That we need to be able to talk to more specifics, because politicians need to understand that just because things are improving doesn't mean that there are not solutions required for specific segments of the population, or whatever. So I think it speaks to the advocacy that we need to do, and also our capability of doing that, just based on our history of quote going deep.
Thank you, Randy. If anyone wants to share their thoughts or questions, please feel free to unmute yourself or use the chat box.
I had a question.
Go ahead.
Shelley from Results Canada. Thanks, Chris, and everyone else for participating. And the question was in my head, and now I worry that it's gone and I haven't figured it out fully yet. But I'm wondering, I think it's kind of about messaging and balancing these positive messages in these incredible strides that we've made over the years, for decades really, and continue to make. And then as we try to dive deeper into the people that are hardest to reach, how do we sort of balance that messaging that what we've been doing has worked really well and this success story, but what we need to do has to change a little bit? And so how do we kind of balance that messaging between celebrating all the strides that we make and ensuring that we're positive, but also, I mean, we can't, because we haven't reached the hardest to reach, we do have to make some changes to how we're working. For example, like going into universal health coverage, or not focusing as exclusively on vertical systems and tackling just TB, like integrating a lot more of our health programs, for example. So how do we balance this positive messaging, and what we've done has been very successful, but what we still need to do will need some change?
I mean, I think that's the ultimate question. As you're talking, Shelley, I'm kind of thinking, again, if we had time, capacity, wherewithal, it would be interesting to be looking at particularly that shift from level 1 to level 2 and 3, that big bulge in the middle that seems to be invisible in the old sort of paradigms about development, us and them, that middle that's so, really driving economic growth and pushing themselves forward through the ladder, the consumers, the this, the that. There's something powerful there about, looking at the work that Results has done in terms of child health, child survival, global education, all of that, how that's been a contributor to that massive shift and bulge. It's not all about, economic growth that is unrelated. It's all tied together in India and China. It's all tied together to these socioeconomic factors. So it would be interesting to sort of show what's possible through a positive lens, but also what needs to be done through that economic sort of space of that income transition from less than $1.90 a day and above, and how the socioeconomic indicators related to global health and education, all those sorts of pieces help push people forward. And I actually think there's a tremendous opportunity right now, and what the World Bank has been doing related to the Human Capital Index. This is actually what that is all about. Again, World Bank, Human Capital Index, but ultimately it is about sort of showing that if we bet on health, education, on the things that we bet on in the past, that those investments don't only just, save lives, they actually build and grow capital. They build economic progress, and ultimately that benefits everybody and does have the health and education impacts in this virtuous cycle that kind of continue to sort of thread through. So that's actually one place that's really interesting for us to sort of tackle, look at, unpack. Maybe it's not that we're talking about Human Capital Index of the World Bank, but we're stealing their messaging and stealing their language and stealing some of their analysis to kind of really embolden and emblazon our advocacy moving forward as it relates to this dichotomy between we've done so much, but there's so much more to do, because then it's one narrative. It's not, again, oppositional sort of paradigms or discussion points. That's one thought.
Anyone else would like to add to that or ask your own question?
I'm going to interrupt again and say that also reminds me, I think there's good core messaging too in the SDGs, which we mentioned quite a lot, but at the core of all of those is driving that change through, well, I guess, a more holistic approach. So I guess it's the shift from the Millennium Development Goals to the SDGs. So maybe there's something in that we can incorporate more heavily into our work and our messaging. I don't know. And I guess spreading more awareness and education about them, because they're still not something that everybody knows about and understands.
Thank you. Anybody else? Maybe it's our last call. Oh, and I'll read what Sherry says. I'm thinking of hosting a midwinter information event where we use these positive messages to encourage people to join our network of connections, even if they're not interested in becoming members or volunteers, I think. So Sherry will discuss more with me.
Good.
Thank you, Sherry. All right. I think that wraps up questions, comments.
It's a good segue to the next part, which is making a difference.
It is. Thank you, everyone. So let me just go back so I can move the slide. Excellent. So making a difference. You want to finish?
Sure, I can start. I mean, it's the so what part of all of this. And I guess, we wouldn't be, the thing about results as an organization is, the connection between education and action is integral to everything that we believe in. Education without action can be a road to exactly the kind of hopelessness that we're trying to fight against, and the theme of this presentation. And so, taking any kind of action, whether it's with results, whether it's with another organization, but kind of being an advocate, being a global citizen in terms of activity and taking everything that we learn and moving forward is integral to, I think, the world that we want to change and the one that we want to create. And so just to say that this is a plug, next slide, for folks to remind people to join us, whether you're new to results or whether you are old, have been around for a long time as part of our community, that results is about education and about action. And this slide just to note some of the ways in which you can help move towards this path to hope, path to progress, advocate around, the sure things and the winning bets. And, this list here, signing up for our monthly actions, our insider notes, our newsletter, taking action. Right now we have a monthly action on water and sanitation. That is addressing the global sanitation crisis, the global toilets crisis, which offers concrete, tangible ways to kind of move that agenda forward. And just contacting Melissa and being more engaged with our work. These are just some ways to kind of join us so that we can kind of take the progress that has been achieved and continue on that path to progress so that we finally kind of create that world free of poverty that we believe exists and that is possible.
Excellent. Thank you so much, Chris. And if I could just add, if you're not sure where to start, just reach out to me as a first step. I'll be able to work with you to try to see what makes sense for you as far as getting involved in taking action or having an impact, because we know that all of our voices combined can actually have an incredible impact. So first step is just reach out, and I'll be more than happy to support you in however way I can. So this is the last slide, so I'll take the opportunity. It's a photo taken yesterday, so you can see that we like to have fun as well. So thank you so much, Chris, for sharing your incredible presentation. It was very, very informative. I thank everyone, and I know actually that everyone enjoyed it quite a lot. So thank you very much for your time on that. And thank you everyone else for joining, asking questions, sharing your thoughts, for being there. As promised, we will follow up by email with a few key links so that you can find out a bit more information. And we will also, of course, send the recording along.
Yeah, let's everybody amplify this. It's a good message to get out. So thanks everybody. Thanks for joining.
Everyone. Have a good rest of your day.
Thanks, Chris. Thanks, Melissa.
Thank you.